As a pediatrician, first we're doing screener questions. We identify kids at high risk for a diagnosis of autism. As a pediatrician, I do not diagnose autism, but I bring those risk factors to the forefront. And again, just like you said, once they hear the term, parents are Googling and I say, Dr. Google is not nice. And now it's ChatGPT. I think the personalized connection that the pediatrician or your clinician or your PCP might have with your child is going to be so much different than what you might get online for sure. You might get very specific information, but if you want to truly understand, you want to clarify those with your PCP. You have one person who can help you navigate through this, somebody an expert in that field, or at least has a lot more experience in that field. Autism. Next important step is getting the diagnosis. The standardized reports are called ADOS-2 and the CORS-2 testing that is usually done by an experienced clinician. It's usually a licensed psychologist, or it can be done by the neurologist or a developmental pediatrician, and you will get a full diagnostic report. Now, the diagnostic report is important to get appropriate therapy services through your insurances. So I think the first step is getting that diagnostic report. The second is then bringing in all the practical aspects of once a diagnosis is completed, then all the practical aspects, that's your therapy referrals as well as your specialist referrals. Some of them can be initiated by the parents. Some of them you might need help with your pediatrician or your provider. As far as the referrals go, I would say age-based. Like let's say your child is less than 3 years, it's very important to go through the ECI, the Early Childhood Intervention Services. If your child is more than 3 years, I would definitely contact the school ISD, because of the IDA, the Individual Disabilities Education Act. The next part is the therapy services, right? You have ABA, speech, OT therapy services, and that you might need help with maybe navigating through the insurances and then, getting those referrals to your PCP. And of course, the final piece is getting the specialist referrals. Again, this might be very individualized for the patient. So, for example, most of them might need referral to an audiologist because they might have speech delay. They might need referral to a neurologist. They might need a referral to a geneticist, right? And they might need a referral to maybe a GI doctor or maybe an endocrinologist because they have growth concerns. Maybe they have nutritional concerns. And sometimes I have one kid who have 10 different specialists. They might need referral to